Still another study concerning testosterone, T, and prostate cancer risk was conducted by lead researcher Jiaochu Zhu, PhD of Texas A&M University in College Station, Texas, and his research team. The researchers monitored 376 men with low testosterone who did not undergo TRT. The age range of the participants was 45 to 74 years, and they were tracked for between 2 through 11 years. During that time, 26 men developed prostate cancer. Here's the significance of that study. The risk for prostate cancer dropped for the men who kept their testosterone levels above 12.1 nanomoles per liter. The researchers determined that men who suffered massive drops in testosterone were more apt to develop prostate cancer. This was especially true if these testosterone losses occurred at younger ages. In other words, the longer the testosterone level remains above the 12.1 nanomoles per liter, the lower the risk of prostate cancer. The cancer risk plunged by 32% for every 1 year increase in age when diagnosed. The more a man's testosterone fluctuated over time, the risk of prostate cancer increased nearly 5-fold. Worse, if a man suffered an enormous drop in testosterone that exceeded 20% of his average, or a relatively substantial median slide within 2 years, increased their cancer risk by 8.5 and 2.7 respectively. The family history of PCA, alcohol use, body mass index or BMI, and smoking were all factors considered. Quote, "Our study is the first to provide evidence of the association between dynamic patterns of T and PCA development and may have substantial clinical impacts on PCA prevention," end quote, Zhu wrote. The researchers hypothesized that healthy prostate cells have a normal range of testosterone that differs with individual men. Unusual testosterone drops in an individual possibly distort the firm, fixed environment inside the prostate and result in cellular changes that may set the stage for prostate cancer. Quote, "Maintaining T levels stable may have a significant impact on PCA prevention," end quote, Dr. Zhu and his team concluded. He added that, quote, "Also, regular monitoring of T levels in males may be useful earlier in life, for example at 40 to 50 years of age, to establish a baseline from which changes could then be detected," end quote. The parade of testosterone's benefits keeps coming. Here's more. A curious statistic. Women are 3 to 9 times more apt than men to be hit with a broad range of autoimmune diseases: systemic lupus, celiac disease, Graves' disease, multiple sclerosis, MS, and rheumatoid arthritis. In addition to suffering from these conditions more often than men, women also get them at earlier ages than men. Why is this? One theory explains the difference in the occurrence of these diseases between men and women as a direct result of testosterone. Men have far more testosterone circulating in their blood than women, as much as 8 times more. Tests on mice have concluded that testosterone provides protection from MS. The focus of the trial was on mast cells. The dictionary definition of a mast cell is a cell filled with basophil granules, found in numbers in connective tissue and releasing histamine and other substances during inflammatory and allergic reactions. The crucial word in that definition was inflammatory. In a recent study on MS using mice, testosterone altered the action of mast cells in the central nervous system, the lymph nodes, and the lining of the brain. In female mice, mast cells pumped out signaling molecules called Th17 cytokines, which cause inflammation. This type of cytokines attacks myelin. Myelin acts as a sheath that surrounds the axon of some nerve cells and forms an electrically insulating layer of protection. When myelin is destroyed, nerve signals and communication slows down and may even stop. This loss of myelin protection is the primary cause of autoimmune disorders, especially MS. Weakened myelin is a significant factor in the progression of the disease. Female mice, like human females, produce fewer amounts of testosterone than males. Here's the fundamental fact. When mast cells located in those crucial areas mentioned earlier are treated with testosterone, a dramatic change happens. Instead of producing Th17 cytokines that cause inflammation, testosterone causes the cytokines to lower inflammation. This action is a result of testosterone causing mast cells to produce cytokine IL-33 in male mice, which opens a floodgate of chemicals to stop Th17 immune cells from attacking the myelin. The study observed male mice with low testosterone levels that had few or no interleukin-33, IL-33, mast cells, and noted that MS acted similarly to the manner it advances in female mice. The researchers concluded that testosterone was the critical element in stopping the advancement of MS. The results of the study were published in the Proceeding of the National Academy of Sciences. Quote, "This suggests a mechanism for the reduced incidence of multiple sclerosis and other autoimmune diseases in males compared to females," end quote, according to lead study author Melissa Brown, PhD. She added that, quote, "These findings could lead to an entirely new kind of therapy for MS, which we greatly need," end quote. Quote, "Because testosterone levels were 7 to 8 times lower in adult women compared to men, we speculated there are insufficient levels in females to activate this protective pathway," end quote, Dr. Brown stated. Quote, "But we showed we can activate the pathway with the guardian molecule IL-33," end quote. "The hope is that women can also enjoy testosterone's protection. Quote, this is why it's vital to study sex differences in research," end quote, Dr. Brown added. The study also noted that men who developed multiple sclerosis later in life are linked to lower testosterone levels. The good news? Several clinical trials that included men with MS have shown that testosterone replacement therapy can somewhat reverse myelin damage and ease the debilitating symptoms of MS. Also, there is hope for successfully treating women with testosterone, as well as men. Dr. Brown concluded that, quote, "Our findings have identified new and more specific cellular and molecular targets for immune intervention that we hope will lead to better therapies that leave most of the immune system intact. This testosterone-driven protective pathway should also be studied in other female-biased autoimmune diseases," end quote. The two drugs that presently are approved for MS treatment work by altering the T cells in MS patients to resemble the T cells in male mice, which lower inflammation rather than elevate it. Research into curing the terrible disease of multiple sclerosis may result in the cytokine IL-33, which is the cytokine testosterone causes mast cells to produce, being added to the tools to eradicate MS once and for all, finally. No question about it, medical research continues to discover the numerous benefits of testosterone, and the investigation is continuing at a blistering pace. Our clinic has the tools, the experience, and the know-how to deliver these cutting-edge benefits to you.